Do you have lipedema or lipo-lymphedema? Have you recently had that diagnosis and aren't sure what it is? Today I'm answering viewer questions about lipedema. Stay tuned for information about this unique lymphatic disorder. Welcome friends, I'm Dr. Melissa Gallagher. I'm a naturopathic physician and one of my core specialties is lymphedema management, all types of lymphedema. In today's video, I'm going to specifically answer what is lipedema or lipo-lymphedema and offer some recommendations for initial treatment plans for you at home. Today's video, I'm answering a viewer question. I want to share with you a question that I received a week ago from Sharon Brandt. She responded to this video. And her question was, I'm so grateful to find you. Do you have any suggestions for lipedema? Thank you. I'll be looking for it. My doctor has no clue. So Sharon, hi, thank you for responding. And to many of you who have asked me about lipedema, what it is, or lipo-lymphedema, today's video is part one of a video series about lipedema. This is a very unique lymphatic disorder. It happens to be a fat disorder. And it's specifically related to men and women who have unique fat storage. It tends to be in the middle section of the body. The butt and the legs are involved, and so a lot of lower extremity lymphedema is related to this fat storage disorder. Essentially, individuals are presenting with fluid swelling in their legs, their abdomen. There's often fibrotic tissue, really intense, deep, thick areas of fluid and thicker skin tissue around the abdomen. Generally speaking, lipedema and lipo-lymphedema impacts women more than men, and the stats on it are pretty alarming. 11% of women are dealing with lipedema, and that is really unique. So that's 1 out of 10 individuals that I see in my practice that are presenting with lipedema or lipo-lymphedema. They may have been diagnosed with lymphedema. They may be dealing with swollen lymph nodes that are very palpable and sometimes even visible underneath the axillary, underneath your armpit, or in the inguinals, right where the leg and the hip meet. So this is a very common disorder, and yet it is uncommonly diagnosed. It's uncommonly discussed by the medical community, and I have to be honest with you. In my books here, these are some of my early training books. There are literally there's like a little paragraph. I have to show you this because this is something that affects my community of providers. This page right here, this is the lipedema communication. This is from my Vatter's Manual Lymphatic Drainage Therapy book. This is the initial book in our course. I have to be honest with you, the majority of my postdoctorate work and my certification work came in the clinical setting, and I'm really excited to impart this knowledge and this expertise to you because I do use some pretty unconventional ways of managing lipedema, but they're really impactful. And I'm going to share with you a case in this video where I helped minimize in 5 weeks. I lowered an individual's fluid levels by 100 pounds and was able to get her off of a bed where she was bedbound for over 3 years. So these videos, this video series I'm creating here on my channel, this is really meant for you viewer who is thinking that maybe lipedema or lipo-lymphedema is impacting you. And I really want to drive home that there is a management option. There is no cure. I'm going to be very honest as well about that. The majority of my cases are individuals that are still mobile, but I am one of the therapists that gets called in for more severe inpatient treatment plans, individuals that are bedbound because of the lipedema, individuals that are immobilized or disabled because of lipedema, and individuals that are in the 500-600 plus pound category because of the fluid and the swelling in these pockets of fibrosis. These individuals that are in the hospital rehab settings that I work with tend to be the further staging in lipedema, where it's now disabling them and they are managing this clinically. So these cases are very unique cases, but if you're watching this and you are mobile or immobilized, this video is specifically for you. Lipo-lymphedema is a fat disorder where the fat accumulates in a particular area of the body, tends to be lower trunk, lower abdomen, and folks will literally present in a pear shape. So there's more fat accumulation around the butt, so these big kind of saddlebag pockets, and there's kind of rolling type of texture to the skin, like the legs will have what looks like fat rolls. So there is a fat element where there's greater accumulation of fat cells, but this is what's really unique about this condition. The fat cells themselves are swollen and accumulating fluid. So essentially the lipo fat cells have lymphedema. The fat cells are swelling. And so our fat cells can actually swell to significant sizes. And as swelling occurs for folks with lipedema or lipo-lymphedema, the swelling starts to obstruct the lymphatic channels, and it also has a direct impact on the vascular channels. We see other symptoms that coincide with this fat tissue disorder. We see hypertension, high blood pressure. We see chronic vascular insufficiency where there will be reddening, particularly from the calf down. And the presentation, I'll show you some pictures here of some of my clinical cases that I've worked with, because this disorder looks very different than your traditional lymphedema. And you will know it if you have it. And if you have a doctor who has not diagnosed you, it's very easy for you to understand that you fall in this category, especially when it comes to the physical presentation of your legs. They tend to be redder in the lower area, calf down. They tend to be more fibrotic, so the tissue around the butt and the pannus, which is the lower abdomen, that's then impacting the lymphatic inguinal nodes in the groin. There's an intense fluid overload in limbs and extremities. It will affect the arms, but primarily we see this in the lower extremity, so belly button down. It is not uncommon for me to be working with an individual that is holding 60, 80, 120 plus pounds of fluid in an extremity, in one single leg. These cases for me are really unique, and I generally get called in by facilities to help facilitate the medical care and treatment plan. But for folks sitting at home that are on the beginning phase of this, the most important thing that we can do is to really start to address the fluid flow and start to minimize your lymphatic congestion by doing decompression therapy. One of the best ways to manage lipedema and lipo-lymphedema is to compress the area that is involved. And I've had many of you ask, how do I get rid of abdominal swelling? And most of those folks that do write me or message me when there's really intense abdominal swelling or fluid retention, more than likely you're falling into this category where your condition is more of a fat disorder in terms of how and where you're accumulating fat. And then based on the accumulation factor, the lymphatics are getting involved, the fat cells are holding fluid, and we now have an edema, we have a lymphedema and a lymphatic condition, a lymphatic disorder, that the only way to manage it from a daily management program is by using herbals and homeopathics and compression therapy. So those three things are crucial for moving your lymphatics. And I will be presenting more videos along this vein here. This is part one, where I wanted to go over what lymphedema is, how it affects people, and really to know that this is a little bit of a more unique disorder, and it's very individualized in terms of its presentation and the different factors that get involved in terms of mobility. Individuals with lipedema and lipo-lymphedema who are being treated or seen by the medical community, and I say that very tongue-in-cheek, many providers are not recognizing your lipedema, and what happens is the common complaint that I see for individuals that come to me who've usually seen an assortment of specialists, there's traditionally three things that they're being thrown in terms of management. The first thing is weight. They're being told you're too fat, your BMI is too high, usually 120 and above, and we want to recommend bariatric surgery, gastric bypass surgery, weight loss surgery. Also a recommendation or script writing for diuretics. And then we want to elevate your legs or elevate your body so that we can get the drainage going. So all three of those things actually are counterproductive and counterintuitive to individuals like myself in the lymphatic therapy community and folks that are managing really intense lymphedema disorders like lipedema, which is a fat disorder now affecting the lymphatic channels and managing edema in the fat cells itself. So the first thing I want to attack is weight. So weight is definitely a factor. It is not uncommon for individuals to hit a certain weight. Usually I see like around 350, 375 being the component that will sometimes set people off, but it's not always the case. And I have folks in the 140, 150 pound category that are presenting with lipedema, but certainly are not going to be recommended bariatric gastric bypass surgery. So I want to address those folks, as well as individuals that fall in kind of the middle category. They're usually going to be around 250, 325 pounds, and they are presenting with traditionally lower abdomen-related weight fluid and weight gain and just weight accumulation. So they're more pear-shaped individuals. And the traditional route is going to definitely be recommending your gastric bypass surgery. Even if you have a good relationship with food, it tends to be the factor. Individuals will be recommended that. And then they're going to give you a diuretic, and they might even recommend to elevate, or you start to use compression socks. And then there are folks like my patient I presented to you in this video that are bedbound and disabled by this condition. With lymphedema and lipo-lymphedema, pain is a big factor. I'm not kidding you. I will have folks that I'm working on them. I'm doing decompression therapy. I might be wrapping them or fitting them for compression. I might be doing some laser treatment to break up the fibrosis. And like light touch literally sends them, oh my gosh, off the table. And so the pain receptivity, the pain involved is really a big factor. That's one of the signs that I look for when I'm intaking my patients is what's their pain factor, what's the pain involvement. Also, is there any osteoarthritis involved? A lot of times the knees and hips and joints that are involved will not only have a lot of pressure, but they will also have a lot of pain, which also includes and involves a lot of inflammation, which is going to be one of the things that we talk about in this video series as well, inflammation and how to reduce that so we can globally address this condition. What I want you to take away from this particular video is really a deeper understanding of what lipedema is and how it's not just about what you're putting in your mouth, and it's not about losing weight instantly, and it's not about doing some intense cardio plan or some really intense type of diet. It really is an overall global management, and the most important type of form of management for lipedema, it has to be individualized because every person presents with lipedema or lipo-lymphedema differently. And I've seen hundreds of cases where every person is different. And so I want to offer this to you folks watching this video. I do offer 30-minute phone or video consultations. And if you feel like I can be a resource for you to tailor a plan and tailor either a compression garment fitting, help you figure out skincare, wound care management, then also look at globally lifestyle and maybe even some dietary changes, what we can do to help bolster your body's fluid reduction, minimize the fibrosis, this fibrotic material that does become involved in this type of condition. I'd love to offer that to you for $40. My goal when I started my YouTube channel was to really reach out through video and reach the lives of individuals who were being poorly serviced, not only by our medical community, but also by the lack of individuals and specialists like myself who have studied and trained in this clinical category of lymphatic management. So I offer that to you. There's a link below. You can check out this link to connect up with my clinic, and we can set you up on my appointment schedule. But really today's video, I wanted to delve into what lipedema is, how it presents, and then my recommendations for compression therapy are crucial. If you're sitting at home and any part of this video is resonating, I want you to know you're not alone, and I totally understand your situation. There are ways to manage this condition in a healthy, productive way that'll get you mobilized. It'll get you engaged in life and create vibrancy in your life and movement in your body so that we can flush the fluid and minimize the fibrosis that is causing immobility, high blood pressure, and even depression, because now you're not doing things like you used to because your body is not working with you and it seems like it's working against you. If this does resonate with you, please shoot me a message. I love hearing from all of my viewers. You guys inspire me every day. I'm just so grateful to impact your health and wellness by this format, and I just really hope that this connects with you. And I'm going to impart as much knowledge and information through my videos to you so that we can get you on a management plan. Because if you are not managing lipedema or lipo-lymphedema at home currently, you need to begin now. And these videos are going to detail how to do that. So please stay tuned as we go through these details. I hope you'll subscribe to my channel if this video was impactful or it resonated with you. If you feel like, oh my gosh, this is totally what I have. I've been watching your videos, Melissa, and I've been doing your exercises, but you have described my body and my condition to a T and I haven't been diagnosed. Please follow this channel. There will be 2 more videos that I'm releasing. It's going to be every week, so please do watch out. I'm going to talk more about compression therapy in the second video. Thank you for your time, and I hope you have a wonderful day.